Okay, now welcome to our fifth video in clinical reasoning, and in this one we're going to talk about probability. So it's a little bit of math, but we're going to basically be talking about concepts. I'm going to break this up into two videos and put the more math-heavy stuff in subsequent videos. Okay, so here's our framework again, and really we're going to be talking about probability in this one, because we have to have a bit of an understanding of what probability is in order to understand how we're going to prioritize our differential diagnosis. And so here are our objectives here. We've got to define probability and thresholds and describe how we set these thresholds. Okay, don't worry, we're going to get to that. So here's a forecast, a weather forecast, and you can see that at 8 a.m. there's a 40% chance of rain. And so that doesn't, so if it rains at 8 a.m., does it mean the weatherman was right or wrong? Or if it doesn't rain at 8 a.m., does it mean the weatherman was right or wrong? It really doesn't. All the weatherman said was that there's a 40% chance of rain. It can happen, or it might not happen. That's just a probability that it will. Now, with this probability of 40%, you have to decide whether you have to weigh the benefits of whether it is worth carrying an umbrella around all day and it not rains, or leaving an umbrella at home and maybe it does rain. So you have to weigh that. So let's talk about probability. So here we have a coin flip. And when you flip a coin, you got one of two options. You got heads or tails. And so what probability is the chance of something happening. And we do that as a fraction. So in this case, the chance of getting heads, that's one of two outcomes. So one of two outcomes. And that equals a half. 1 over 2. And 50, that's the same as 50%. And same with this. One of two outcomes is 50%. So there's a 50% chance you'll get a tails and a 50% chance you're going to get a heads. And so the formula really is the number of outcomes that you're looking for over the number of total possible outcomes. And the number of outcomes I'm looking for here is heads. What's the probability of getting heads? Well, it's 1 out of 2, 50, and the probability of getting tails is 1 out of 2. Let's look at dice. Okay, so here we got dice. So what is the probability of rolling a 3? Well, that would be 1 out of 6 outcomes, right? And so here we got 1 out of 6, and that is equivalent of about 17%. 1 out of 6 outcomes. And so again, here's the formula, the number of outcomes you're looking for over the number of total possible outcomes. But let's say now instead that we are looking for the probability of getting a number less than 3. So that's number 1 or 2. So what is the probability of this? Well, it's 1, 2. There's 2 possibilities out of 6. So 2 divided by 6. 2 outcomes we're looking for, either a 1 or a 2, over 6 possible outcomes. 2 over 6 equals 1/3 equals 33%. So again, that's what is important to know, is that probability, we usually are going to refer to it as a percent, and it goes between 0 and 100. 100% means it's definitely going to happen, and 0% is it's definitely not going to happen. All right? And so probability is not intuitive. We, as people, we don't think with these numerical sense. Even mathematicians and statisticians and physicians, we've been shown not to have an intuitive grasp of this. But we can do our best. So I mean, when I would look at this, what is the probability of getting 5 heads and 5 tails? I would think, well, it'd be half, right? Because half of them are heads and half of them are tails. But it really isn't. What it is there's 252 different ways that we could get 5 heads. It could be like this: head, 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 tail, 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 or it could go head, tail, head, tail, head, tail, right? So there's 252 ways. So there's a 24 out of 1,024 possible outcomes of flipping a coin 10 times. So 24.61%. Similarly, if you wanted to look at getting 7 heads, that's about 11%. And if you want to look at getting all heads, that's 0.098%, so a 0.1%, really. And so if you actually can plot all these probabilities here, and you can see that this is getting 0 heads, 1, 2, 3, 4, 5, 6, all the way up to 10, and you can see that you're most likely going to get 5, right? But there's only like a 24% chance of getting half heads and half tails, and then 4 and 6 and are even more likely. So when you flip a coin 5 times, you're not going to get half heads and half tails. You would not be surprised to get 3 tails and 7 heads. You would also not be surprised to get 2 heads and 8 tails. It would not be surprising because the probability is still there. Okay? So now, probability, we looked at it in the weather forecast, we looked at it with dice, and we looked at flipping a coin, but we have the same thing with diseases and diagnoses. And so when we talk about the probability in our differential diagnosis, we're talking about the probability that a particular diagnosis is correct, that a patient has that diagnosis. Now remember, 0%, 100% means it's definitely going to happen, or the patient definitely has a diagnosis, and 0% means that they definitely don't. All right, and that's rarely going to happen. So here we got 3 diagnoses for someone who is presenting with headache. All right, so maybe we think there's an 80% chance that this person has a headache, 35%, 30 or 41% chance that it's an intracranial bleed, and a 12% chance that it's meningitis. All right, and so you will never, ever, ever, ever get a 0 or 100% chance, because there's no way to know with 100% certainty, or conversely 0% certainty that somebody has or doesn't have something, because freak things happen. There's so much biologic variability in patients, and patients will interpret their body in different ways, and there's no certainty in medicine. So that's really what I want to say is you can get pretty darn close to 100%, but you'll never get to 100%. And so what do we do about that? Well, what we do about that then is we set thresholds. We say, well, how close is close enough, right? So if I'm above 80%, you know what, that's close enough. I'm going to say they have that diagnosis. Or let's say I'm below 20% in this case, then I'm happy to say they don't have that diagnosis. All right? And then in this middle here, you don't know what's going on. You don't know that they do or don't have that diagnosis. And so we can break this little probability space into 3 different areas. In the one above the treatment threshold, which means, remember, above this percent, we say, you know what, I'm not 100% sure they have it, but I'm sure enough that they have it that I'm willing to treat them. So I call this the treat it zone. And then down here below the testing threshold, you could say, don't have 0% certainty they have the diagnosis, or conversely, I'm not 100% sure that they don't have the diagnosis, but I'm sure enough that they don't. So I'm done with it. I'm not going to consider it anymore. So I'm trashing it. So I call this the trash it zone. And then in between, we have the test it zone, which is where we're not sure and we need to get some more information. And so what we need to do with every diagnosis is we need to get more information to push it out of the test it zone into either the treat it zone, where we say, okay, you have this diagnosis. As far as I'm concerned, I'm sure enough, and I'm going to start treating it. Or push it down into the trash it zone, where we say, okay, you know what? I feel pretty good that you don't have this diagnosis, and I don't think that we have to pursue it any further. And so evidence in support of a diagnosis that you collect is going to push it upwards. And it might not push it all the way past the treatment threshold, but it's going to keep pushing it up. And then you just got to get enough information that you feel sure enough that they have it, that you're in the treated zone. Similarly, evidence that falls against the diagnosis, that doesn't jibe with it, is going to push it down into the trash it zone. It's going to move its probability downward, in which case, and once you cross this threshold, you can say that they don't have it anymore. Okay, so how do you set these thresholds? The treatment and the testing thresholds. You really have to weigh the cost of these different zones. And the treated one, it's the cost of treatment and the cost of testing and the cost of doing nothing down here. So the treatment threshold, you got to weigh the cost of treatment versus the cost of testing. And for testing, you got to weigh the cost of doing nothing versus the cost of testing. Let's look at some examples to make this clearer. Okay, so here we have we're going to look at the treatment threshold. And so the cost of treatment versus the cost of testing is what we're going to look at. So tests that, if we want to move this threshold up, what's going to happen is we're going to shrink the treated zone, meaning we're less likely to treat something and more likely to test it. If we move it down, if we push it down, then what's going to happen is we're going to shrink the tested zone. And we're saying we're more likely to treat something than we are to test it. And when we do that is if we have safe treatments, then we're more than willing to expand this zone, right? Because there's not that much detriment in treating. Or if testing itself is dangerous, then we want to shrink this zone. And conversely here, if testing is cheap and safe, then you know what, you can say go ahead and make the tested zone bigger, because it's not going to be harmful to do that. And for the treatment zone, you're going to say, well, if the treatment is dangerous, then I don't want to treat too many people, so go ahead and shrink this one. And so let's say, for example, you have someone with a heart attack and the treatment is an angioplasty. So that's potentially dangerous, right? So you don't have someone come in and say, okay, I think I have a heart attack. Let's take you to get an angioplasty, stick a needle in your leg, and have the potential of tearing one of your coronary arteries, and then have to open up your chest in order to save you. That's dangerous. Well, what is a test? The tests that we can do is we can do an EKG, which is a piece of paper, which probably costs 40 cents, and we just have to interpret what it shows on there, as well as some blood tests. And you say, you know what? The tests are cheap and safe, and the treatment is potentially dangerous, so maybe we want to move this up, right? Now let's look at the testing threshold. Similarly, you got to weigh the cost of testing versus the cost of doing nothing. And so whenever we move this down, we're shrinking the trash threshold and growing the tested threshold. And if we move it up, then we are growing the trash it area, and we're shrinking the tested zone. So to move this up, again, you want to do it for tests that are dangerous or maybe expensive. So let's look at an example here. All right, so you have a test that is dangerous versus it's cheap and safe to do nothing. So let's say you have somebody and you're wondering about whether they have heartburn, okay? And the test for it would be to do an endoscopy or maybe a blood test, but let's just say we're going to do an endoscopy, which is where you stick a camera down someone's throat and you look there and you make sure that there's no damage to the esophagus and stomach. Now that has its risks. You could tear anything as you're sticking it down there, and it's very uncomfortable, and it's not cheap to do. But what about doing nothing? What if you don't make that diagnosis? Is it going to kill them? No. And so in that case, you might want to move this testing threshold up and limit the amount of testing that you're doing. Similarly, or conversely, for lowering the testing threshold, you're going to do it for tests that are safe and cheap, and it's dangerous to do nothing. And so maybe you have a diagnosis like a blood clot, pulmonary embolus, which could be fatal if you miss it. And so you say, well, the cost of doing nothing is and missing that diagnosis is pretty big. But the test is a simple blood test. Let's say a D-dimer blood test, and if that's normal in this low-risk patient, I'm pretty feel confident that they don't have this. And so in that case, you might want to move this threshold down. Okay,